Now we're, as of yesterday, when we gave the order, FEMA is totally involved in addition to everybody else, and a lot of progress is being made, so I look forward to speaking to the governors. And from what I understand, we have pretty close to 50 of the governors and some territories on, and we have a lot of, just about everybody showed up, so that's very nice. And buy what you can, do the best you can to get what you can actually get. And we're also having a lot of things produced that, frankly, nobody's ever seen anything like this before. But do the best you can, and on block grants, we're going to consider that very strongly.
Over 50% of the cases are in 3 states. Over 50% of the cases are in just 10 counties. So it's the 3 primary states of California, Washington, and New York, with the addition counties of New Orleans and Cook County. We are very concerned and remain concerned in urban areas where mitigation and social distancing is absolutely crucial. The issue of decreasing spread due to contaminated counters and other things in restaurants and bars, as well as movie theaters, is absolutely critical. So I know you're concerned about your hospitals, but critically you need to make sure that all elective medical and surgical procedures and dental procedures have been canceled. It's important that we're tracking the data on a county by county as granularly as we can, because we can look at whether mitigation is working in those. We'll get feedback from your community. This will only be solved if every single person in every single community takes responsibility to ensure they're following the presidential guidelines that were put out several days ago for the 2 weeks of stopping this virus. And so we can ensure that we have prioritized all stockpile elements based on the needs and the case structure that has been reported. Reporting becomes critical. If we can't see it, we don't know how to unlock the stockpiles. So this, both test negative and test positives, are going to be absolutely essential, as well as hospital admissions and CCU beds, so that we understand exactly what is required from the federal government.
The President asked me to emphasize, we want to encourage every governor on this call to convene your leading healthcare providers today to take inventory of your medical supply needs. And we urge you to remind them that they need to look to their supply chains first. We'll prioritize accordingly. And any states that are in the middle of critical response, know that we will work with you to get you what you need. Other states, you need to talk to your healthcare leaders, providers, and make sure that they are going to the supply chain